Okay, folks, county commission meeting. Brett, you're on. Was Celeste trying to get in? Did you get in, Celeste? All right, we're texting.
Chris is going to check, give it to her here in a second.
Okay.
Good morning.
Morning, Jimmy.
How are you, sir?
I'm good, this problem.
I'm here.
Hey, guys.
Hey.
This is Pat.
Hey, Pat.
Yeah, she tried again, got the same message, Chris.
Okay.
Marty, I was able to get in without any problem.
Okay, good.
This is Mark, I got in, no problem.
Yeah, Celeste is having some problem. We're gonna have Chris Whitaker get over her.
She had a problem last week too, didn't she, a little bit? Yeah.
Well, it was a phone power issue, right?
Oh, yeah, well, yeah.
What was up with that phone issue? Power. Why did the power go out?
Is that one on Latrobe Street, they had some lines down or something?
Yeah.
Looked like all of 7th Street was up when I left here.
No looting reported, right, Tom?
And here we go.
No looting during the power outage.
Oh, Chris.
On 7th Street, who would want it?
We have a COVID update. Talked to the health department. They believe that we've requested to be removed from the hotspot designation. I imagine the governor will announce that at his 12:30 press conference. But we're awaiting the governor's response. So we did have a good conversation with Brian Abraham. We had a great conversation with Dr. Whitaker and Eric Walker from the Middle High Valley Health Department. We believe we will fall into the West Virginia Strong, the comeback order of the governor, which is safer at home. But we await his designation. It's the governor's order, not ours. So, Tom, I think that's good news. We still have confirmed cases. Our numbers rose somewhat through the West Virginia DHHR website. I can't get that content right this minute. But the governor has replaced his order. So Monday, May 4th at 12 a.m. Safer at home. And thank God, pet groomers are allowed to open. We're continuing with our social distancing and having our meetings conducted at the Judge Black Annex.
Blair, is today the day that the governor would give us 1 week advance notice that government offices will be reopening? Or I know that was week 3 through 6. I'm trying to figure out for the courthouse.
Yeah, I really am not sure. The discussion has been other courthouses. They believe May 11th.
Which would be the week's advance notice today.
Right.
So we can get geared up is what I'm thinking.
Once again, we're following the governor's order.
Right.
So a lot of commissions are saying May 11th based on that being week 3.
But it was 3 through 6. I didn't know.
If he wants to do something different.
Right.
We'd have to make some special preps or not.
What are we doing in anticipation of that right now? We do need to mark in our areas where we have public 6-foot increments.
Well, I think what Mark did in the clerk's office, he's got a big sign, you wait outside, and then he can put 6 feet back from that each one.
Same over here.
it's something we're all gonna have to, probably the electeds have to get together and decide, yeah. I mean, what do you do in the elevator, you know? Allow a bunch of people in the elevator all the time. So we'll have to come up with a set of regs, but that'll give us a week to do it.
I saw foot switches. Is this that week? This week? Today's May 4th. May 11th 's next Monday.
Right. What I was asking was that I'm anticipating that part of his press conference today will be to announce what's gonna happen in weeks three through 6. So hopefully 3 will be open government offices.
Yeah. Yeah, he just gives that broad weeks 3 through 6.
And there's something about government offices, I don't see it right off, but it was on there.
The governor's office will announce which of these businesses will be able to reopen at least 1 week in advance. Today's press conference will be delightful.
Could be.
We'll have wine with DeWine at 2 o'clock.
There you go. That's just fine.
Yeah.
Good social distance, maintain 6 feet. Marty and Bob are gonna get it.
I'm leaning back.
I see, trying. All right, that's the information we know about the COVID. The health department still continues to do tracing. They continue with their heavy lift. Washington County numbers are pretty heavy. Wood County numbers have stayed low, and that may be a result of the testing. And without further ado, we have Schwindem Agency here to present to us about our healthcare options this week, today. And so Marty, it looks like he has handouts.
I do.
And then we will, the electeds on the phone, you'll certainly be able to get a copy whenever you so desire. Come on.
Would you like me to start in?
Go right ahead.
Okay, great. Well, good morning. A little bit different circumstances, as I know we've been operating under for quite some time. This is Mark Schwindeman, for those of you that are participating remotely. We are pleased to present the renewal options, or I should say the renewal calculations for Wood County's plan, which will be effective July 1, 2020. I'll walk us through a narrative that we put together, very similar to what we've done in previous years. I certainly won't read this all to you, so I'll paraphrase some of it. So as we get started, we'll start with health insurance. The health insurance plan for Wood County Commission for the last several years has been made up of 2 component parts. One being the health insurance policy with Highmark Blue Cross Blue Shield. That policy has a $4,000 deductible per individual, so it's a high deductible health insurance policy. Coupled with that is a health reimbursement arrangement, or we call it an HRA, that reimburses the plan participants the majority of that deductible should they have claims. So we'll talk about the construct of those 2 as we go through this. The initial rate renewal from Highmark called for a 15.4% increase. Claims experience had escalated quite a bit this year as compared to previous years. I'll comment on that. It's the actual 3rd bullet point down. The claims experience during the base period, the 12-month experience period that's used, had escalated, so the loss ratio, claims to premium, was roughly 88% during that time period. 12 of the claimants had, or we call them high claimants because of the amount of claims above $50,000, for the number of folks that had claims above $50,000 during that year. There were 12 in totaling $1.3 million in claim payments. Contrasting that with the previous year, the loss ratio was at 70% claims to premium. So claims experience had escalated. Highmark reviewed an additional 6 months worth of claims to get closer to the renewal. Unfortunately, during that time period, the claims actually went up higher. the claims to premium was 128%. So money taken out of the pot was greater than money being put into the pot by Wood County. However, a good portion of those claimants had claims that exceeded what we call the reinsurance point or pooling point. Highmark has in their plan that if anyone exceeds $125,000 in claims, the amount above that is removed from your claims experience for calculation. As a result, after some discussion, but quite frankly, I have to tell you that Highmark really initiated this rate reduction. So they brought the rate increase down from 15.4 to a 4.9% increase. So a very significant drop in the increase of the rate renewal.
What kind of reasons do you have, main reason for that deduction would be?
Probably, Commissioner Colombo, main reasons for the deductions really are twofold. The claims that were being able to be removed from the claims experience because of that reinsurance level at $125,000, pulled out about $435,000 of those claims. And then secondly, quite frankly, it's been a long-term relationship that Wood County's had with Highmark Blue Cross.
Has Highmark offered this kind of stuff to other clients that you might have too? I shouldn't ask other clients, but
Yeah.
Is this a policy of theirs to reward a good job by a group?
Yes. Yeah, the answer to your question is yes. It's the policy of theirs that there's been a long-term relationship, and if there's any way to reduce an initial increase, then they'll do that. The increases actually come down from the Pittsburgh office, the rate renewal initially, and then it's reviewed by the local underwriters at Highmark, so there's discussion back and forth. So the answer to that question is yes. We have another example just like this, where that was done for a long-term client as well. Sure. So the chart under bullet point 2 on the first page, that's kind of a busy chart. It'll show the monthly premiums. These would be the total premiums that Highmark would be charging to the commission. The first column, you'll see the 4-tier rates: single, employee plus spouse, employee plus children and family, based on the total contract counts of 97 single, 21 employee spouse, 6 employee children, and 54 families. That was your current census just recently. The total annual premium, if that would stay stagnant, that those contract counts stay the same throughout the year, would be $2,681,000. With the 4.9% increase, next column over, those same rates go up by the 4.9%, or an expectation that your total cost would be $2.8 million, $2,813,000, reflective of the roughly 5% increase. Just below that, which would be the line item or the row next to the bottom, where it says estimated HRA reimbursements, that's the amount that the county has paid out, the $318,000. We're anticipating to pay out by the end of June for those claimants that have actually satisfied their deductible, or a portion of the deductible, the county's reimbursements to those individuals. So the total cost we expect this year to be just shy of $3 million, $2,997,000 or $999,000. Next year, if those HRA reimbursements would stay the same, roughly, we'd expect your cost to go up to $3.1 million. What's interesting to note, I'll reference back to this and stop for a moment for questions. Get down towards the bottom, the last bullet point on the first page, the renewal rates have been very favorable over the last 4 years. If you recall, the years prior to 2017, we saw a pretty substantial escalation in rates because the claims experience was increasing dramatically. Claims experience has tempered somewhat, actually went down the 2 previous years, came up some this year, but that pooling point or that reinsurance level helped considerably. So in 2017, you had no rate increase. 2018, July of 2018, there was a 5% reduction. 2019, there was another 9% reduction. And this current year for the renewal for 2020, we're seeing a 4.9% increase. During that same 4-year period, average inflation trend for healthcare costs with Highmark ranged between 8 and 9%
Per year?
per year.
So, am I going out on a limb to say that you probably don't have a lot of clients that have that kind of a history?
You would be way out on a limb. figuratively speaking, simply because we have no other clients that have had this type of great renewal history out of roughly 300 employers that we work with.
It's amazing.
It is amazing. Some of it is cost containment, some of it is somewhat luck of the draw. Quite frankly, the healthcare costs that were associated with the conditions that the employees have weren't as dramatic. But this history is phenomenal. We don't have, if we look at this effectively, you have the same rates as you did in 2016. So, questions so far? I'll keep moving. Page 2. As I mentioned earlier, the health insurance benefits are comprised of the two component parts, the health insurance policy and then the health reimbursement arrangement. Second paragraph, the deductibles for the health